Welcome to the Living Second Nature podcast. My name is Shodi Morris. Super happy that you're joining us again for this stellar interview. Another fun guest in the lineup today, someone that I've gotten to know well over the last two and a half years. Our guest today has some astounding credentials behind him. He has 2 bachelor degrees from UW River Falls. One is a Bachelor of Science in Psychology, and the other is a Bachelor's of Arts in Music. And then he spent the next 3 years getting his master's degree in music therapy through Augsburg University. Then in 2021, our guest went on to take his boards to become a board-certified music therapist. And his first step out into the world of music therapy was through St. Croix Hospice and doing that line of work, which I'm sure can be some heavy work, and wanting to venture out of that and into a new, fresh world of music therapy. He then birthed his own new business called Downbeat Music Therapy. A warm and exciting welcome for Brandon Westholm.
Thank you so much for having me. I'm excited to be here.
Good, thank you.
Yeah, it's my pleasure.
I'm a geek when it comes to alignment and how things unfold and meeting people. So I just kind of want to share that fun little experience. Gosh, I think it'll be 3 years this August.
Yeah.
So a little over 2.5 years ago, I took my little one, who was still 2 at the time, Amira, to a drumming circle in McGregor. And it was last weekend in August. And the night before, I ran across the event on Facebook. And I was like, oh my gosh, this looks amazing. Well, knowing myself well enough, I work every other Saturday, and the next day was my Saturday to work. And I was like, once I get home, I'll probably talk myself out of going because it's just more comfortable to stay home and decompress. But that night, I actually had a dream about the drumming circle that I had contemplated going to the next day, and I knew that meant I needed to go. So Amira and I ventured out and did not know what to expect. I envisioned maybe a bunch of kind of earthy hippie people, and it was actually a group of all older, I think retired age ladies. And so we just joined in, and Amir was in the middle of the circle dancing around and playing some little percussion instruments and having a grand old time. And I think it was about halfway through, Brandon and his wife and their son that was only a month old came strolling by.
Feels like so long ago.
I know, and stopped, and Brandon just happened to, I think you had your own bag of percussion.
Yeah, I brought a small bag.
And so anyway, I was one of the ladies was just asking Brandon, who are you? What do you do? And then I had this light bulb moment go off, I wonder if he would ever want to connect through my Healing Arts and Wellness Center in the future. So anyway, once Brandon introduced himself in the circle, that was the moment I knew why I had the dream and why I needed to be there. So anyhow, it's just always fun for me to reflect back to the beginning.
Yeah, I remember vividly bringing our son at that time. And you're right, he was right around a month old or so. And it was just really fun to get together and make music with people. I love doing that. And it was pure, for me at least, just amazing happenstance and an event that has changed my life a lot and changed the trajectory of where I've been going. I wasn't sure about business ownership, and you have been a huge part in helping me get out on my own, so I appreciate that.
Good. Thank you. That's awesome. So, yeah, let's just talk about music therapy. what that means, what that looks like, how it's utilized to help people, and what kind of things it's used for. Like that's like a broad question. But
yeah, I was going to say I could speak for a while on that. So
I feel like it's fairly new, at least for this area.
For sure.
So
For sure. Yeah. So, I mean, music therapy, I get asked that question all the time about what the heck is music therapy and what do you do? What does a session look like? So there's a lot of pieces there. I'll say if you want a clear definition of music therapy, it's going to change from one practitioner to the next. Mm-hmm. But in general, you're looking for music-based interventions that target almost exclusively non-musical goals. Occasionally the goals are musical. But what you're going to run into is music therapists are the people that are doing those interventions. And so there's a big difference between what a music therapist does and what someone else who is using music does. So I'll give you a couple examples that usually fleshes it out a little bit better. The first one I'll give is that music therapists do a lot with people that have different types of disabilities or different types of areas of need, things that they need help with or need assistance with. This could boil down to individuals on the autism spectrum. It could be people with developmental disorders. We work from crib to casket. So we work with kids that are just born, premature infants in hospitals and in neonatal intensive care units. We work all the way from there up until when people are in hospice and they're starting to transition out of this world. And so what you'll see is that music therapists target specific needs of each of those populations in order to essentially bring them more health and wellness through that space. Two specific things I'll talk about. Let's talk about autism for just 1 second. A lot of the work that I do currently is based on communication goals and on socialization goals. And so I'll be using musical instruments or creating music together or what have you to connect an individual more with their environment and more with the people around them so that they can better access those things on their own when I'm not there. That's a huge goal that we work on, is just how do you communicate and connect with the world around you, and how can I use music to foster that connection, as opposed to something where, like, if a volunteer went to go play music in a hospital, that's very therapeutic. That's wonderful. I encourage it. It's not music therapy. It's not the same thing as spending time one-on-one with someone, developing goals with that person, and working on those things individually. And we do groups, but it's very individualized in terms of the goals that we're working on with each person.
Gotcha. Yes, that makes sense. So, let's see here. We were talking about, like, what is music therapy? How is it applied? Do you have... So you've been actively had your practice for a couple years now.
Just over 2 years. Mm-hmm. Yeah. 2 years in March. Yep.
Talk about maybe give some examples of some of the progression that you've seen with applying music therapy.
Absolutely. I think of a particular case where I have a client that, you wouldn't be able to tell that there's underlying conditions just by meeting this individual. They might seem shy, but at the end of the day, they have a very, very tough time forming social connection with other people and with understanding rules of just social engagement in general. It's tough for them to grasp that. So some of the things that we'll focus on with that and see the progression of is seeing someone come in, not be able to listen to if I set a rule or I set a boundary for, like, hey, I'm going to play with this and you're going to play with that. And they're like, no, I have to play with those things. And it's like, okay, I'm just not able to respond to that. And then within 3 to 6 months, seeing a situation where both that client and myself can collaboratively engage in games that we just create on the fly, just with each other, where it's like, hey, I want you to go throw these things over there in that basket, and then I'll come and search for them later. And it's me directing that as opposed to the client. And that's huge for at least this specific client, because at the beginning of our sessions, he was not able to do that. Not with his peers, not with me, not with his parents. And so seeing that progression of he can listen to someone else and collaborate with them was so huge for them. And this child was about 7 years old. So this had been going on for him for about 2.5 or 3 years.
Mm-hmm. Oh, awesome. It's got to be so rewarding to experience that progression and be able to reach a person in a whole new way that has not yet, that they haven't been able to progress. So
yeah, definitely meaningful, the work that I do. There are days when when it's painful and days when it's meaningful and days when it's both. And I'm here for all of it. I think that it's important to ride those waves, and acknowledge that both are present.
One of the things that I enjoy about our conversations and our work together is my background is more from the energetic side of things with our energy body, our chakras, sound vibrations, and yours is more of like the scientific base, even though now like the energetic part of us is also science-based, but yours is a different approach, which I love. And you and I have often been able to have great conversations and learn from each other. It's almost like us learning each other's languages, where it really kind of is, they work together, they're all happening, but we recognize them just differently. So that has been fun. And I love your curiosity to be able to try to understand music as, vibration, and how that can shift and change things for people as well, which is a whole, totally different than the way that you were, trained in applying music therapy.
Absolutely. Yeah. I think it's vital for someone to be curious when they're in this field or in a therapeutic field or in any field where you're working with human beings, in my opinion. That curiosity is huge. And so for me, I'm a very analytical human being, and my profession lines up with that pretty well. When you go and explore music therapy, you'll run into it a lot where it's all evidence-based practice. It's all research-based practice. So we do very intense work on the research side of things to make sure that what we're doing has clinical evidence behind it and also the research backing. Both are very important. However, curiosity and exploring and trying new things as part of sessions and just being creative is, I would say, just as important. You have to hold both of those things at the same time when you're doing music therapy. So on a personal level for me, when I'm talking to you about the types of work and the energy work and other things that I don't understand and I don't have a good grasp of, that's purely, for me, it's curiosity, and I want to understand more and I want to explore, because I know that there's things in the world that I don't know, obviously, and I feel like everyone should have that approach, but and I want to learn more, also with the understanding that I'll never fully grasp everything I want to know, but curiosity it's vital.
I think that goes for all of us, that we'll probably never be able to really fully grasp everything we're curious about. Of course not. So what made you choose music therapy as a career, and at what point in your life did you know that you were going to head down that path?
Yeah, it's funny. I had an older brother. I still have an older brother who's a music teacher, and our family is and was very musical. So part of my life was always wrapped up in music ever since the time I was little. Playing saxophone, and that was my primary instrument, and doing more with that. So music was always part of my life. I always liked to perform and be part of musicals or things like that. I always knew I loved music. It was only later into my later teen years and getting into my 20s that I discovered how much I really loved people and how much I had just a heart for helping people and being alongside them as they struggle or as they are looking for solutions to life's problems. And I really wanted to find a way to mix the two of those things. And that was the entire frame for finding music therapy, was I love music, but I love people more, and I have to find a way to mix those things. And my wife was she was my girlfriend at the time, but a huge part in helping me find that path and really not giving up on the idea that I could find that path. And finding music therapy was huge for me. I was at River Falls at the time doing undergrad degrees in psych and music, and then went for the master's, even though we can get into the education side later if we want, but the master's is not required to be a music therapist at this point in time. And I could have done a different path to maybe become a music therapist quicker, but I wasn't interested in that path. Again, I'm a very analytical mind. I wanted to understand what I was getting into. So
I think when we had this conversation a couple weeks ago, and you had said that a master's wasn't required to be a music therapist, and I was like, wait, tell me what your journey was again. And you're like, well, I did this and this and this. And I think I just looked at you and said, yeah, you overachiever.
Yeah. Yeah, I've been told that before.
Well, that's okay. I can relate. So it sounds like that it was during your journey at River Falls when things were kind of coming together for you, as far as realizing and bringing together like what you really kind of wanted to do with that.
Yeah, I had some great support at River Falls, not only from my girlfriend Allie, but also from professors there at River Falls, that there wasn't a music therapy program at River Falls. And you can go and get a bachelor's in music therapy. I did not do that. I really fell in love with River Falls and I stuck there, and I discovered music therapy as I was already there. So for me, transferring was out of the option just because I loved the people that were there, the support I had. But multiple professors at River Falls were very open to discussing music therapy with me, helping me explore it, even taking me to go see a music therapist at one point in time. I remember Dr. David Milne, I don't know if he's there anymore, I think he is, but drove me into Minneapolis, and we went to an elderly folks home, and I got to see a music therapist for the first time in person. And that was a huge moment for me, just to see that it was real. I know I had heard of it. I had studied it. I had never seen it in action. So that was a beautiful moment for me, because it solidified a lot for me. It helped me understand that I wanted to do that it's still in my head. I want to do that the rest of my life.
So, can we talk just a little bit about what music therapy looked like? So now, like you said, you're doing a lot of work with kids, whether it's autism or learning disabilities. What did music therapy look like for you when you were working in hospice?
Yeah, so in hospice, the primary referral reasons that I got were, a lot of it was Alzheimer's and dementia, so declining memory, and how can we use music-based interventions to sustain memory and sustain connection to the world for as long as possible. I got referrals for Parkinson's disorder, so learning how to build those motor skills, well, not technically build, but maintain as much as possible, maintain cognition and things like that. At the end of the day, a ton of it was for restlessness and pain and anxiety and stuff that was really chronic, especially as people age. It's hard to get away from. The majority of people, as they age and get to that stage of life, have a lot of pain, have a lot of suffering, and a lot of agitation. And so a lot of the work that I was doing at that time was just based around relieving those things. And
so
sorry.
Were you facilitating and actually playing music for them, or were you playing music like were you actually playing instruments, or were you playing music to them, or both?
So definitely both. Each person is very different. Human beings are all different. A lot of them really liked when I would come with a guitar, sit down, talk to them about how they were feeling. We play songs, we reminisce about those songs, and that music that I would bring is personalized to them, stuff that they are into. So it's very important to use client-preferred music in the work that you do, just because it establishes such a connection with people. I'm sure we can all relate, you and I, but anyone listening, that music has a hold on certain areas of life, whether it be the canon in D, you think about weddings, or you think about kids' music and you think about how your kids were when they were growing up. Like, music has such a pull on life, and talking to clients about, hey, what music was or is important to you, and can I play that for you? Can we sing that together? Can we reminisce about those times? And what else can we do? And that's the primary kind of set of what I was doing in hospice. It expanded beyond that depending on what we were treating and what we were looking at. But I was very interested personally on learning more of the medical side of things while I was in hospice, so that I could support that as well. Because it was me and the chaplain who were working more on the emotional, spiritual side of things. And a lot of the other interventions were obviously medicine and trying to treat that side of things too. So I was very interested in how I could support across the spectrum, and not just say like, they felt good today, but hey, keep an eye on their like anxiety and pain meds, see if we can't drop those just a titch. And obviously relying on the nurses' expertise, that's what they do. But trying to say, hey, with, weekly sessions with this person, I'm wondering if we can reduce those and see if we can't get more behavioral interventions or music-based interventions to help drop pain and anxiety, and then rely less on medications. And I think that was a really important part of my work.
One of the stories that you had shared with your hospice work really had stuck with me, and it was I won't say it exactly right. You can expand on it, but I think you were working with maybe a lady, I think. I'm not sure, but someone who was putting together, like, I think you guys were creating music together.
I know what you're talking about.
Yes,
Yeah.
talk about it. It's so good.
Yeah.
It makes me teary-eyed.
So I'll say really quickly, music therapists have kind of 4 main methods that they work with: recreative, receptive, composition, and improvisational. And the line gets blurred a lot between those, but with this particular client, she was in her late 30s, early 40s. I think she turned 40 when I was working with her, and she had Lou Gehrig's disease, and she was on hospice for a while. And while she was still able and physically able, we would create music together. She had a small metal drum that she loved to play, and we would sing songs and play the drum together. We would make up songs, but at some point she revealed to me that she had written poetry. And it was a long time ago that she wrote that poetry. It was about her childhood experiences with foster care and kind of being in and out and not really having a strong parental figure at that time. And so for me, I, upon much discussion with her, asked if we could use that poetry in order to write music together with her lyrics, not mine. And it was a process of every session we'd sit down, I would explore some chords with her and say, hey, does this sound right? Or can we change this? Like, do we want to, use a different chord here that's maybe more emotional for you? Maybe adds more tension, things like that. And so we were creating music and songwriting together with her lyrics and me kind of throwing musical ideas out there for her to try. And at the end of it, I was able to get all of that done in terms of having all the lyrics put together, the chords put together, and assisting her with singing along and recording her voice as well as recording mine. And we were able to get that on a CD and give it to the family for them to have. So that's something that they can listen back to and have a memento of their loved one for forever, which I think is really important in hospice work, that if someone is looking for a legacy project or looking for something to remember their loved one by, that music therapy can provide that in a variety of ways. It's not always wanted. It's because it can be very painful to say, hey, we're going to make this for when they're gone. It's like, I don't want to think about that. A lot of families are very appreciative to have it, though.
On the other side of that.
Yeah.
Yeah, that is so powerful.
I think about her a lot.
Oh, yeah, that stuck with me. That story really stuck with me. You and I remember asking you oodles of questions over the last couple years, and one of them with music being, some people pick up music when they're a child and stick with it. Some people pick up music as far as playing music themselves or dinging around with instruments, some not until they're older. And I'm always curious about what it is within a person and what makes it stick versus what makes it fall away. So example being my son Gavin, he wanted to be in band. He's 25 now, but when he was I think band starts in 5th grade, 6th grade, something like that. He was in, I think he did percussion, and he did it for, I can't remember, maybe a year. Dan and I always just said, if you start something, great. If you don't want to continue, that's fine. But you have to at least finish out the year that you start. And I think Gav stuck with it just 1 or 2 years. And he just said, I like to play music, but just on my own time, kind of organically, not being forced to practice and perform. And Draven played saxophone for 2.
That's my guy. He plays saxophone.
I'm sorry. I misstated that. It was a trombone. Gosh.
I now no longer am a fan.
Okay. I'll tell him. No.
Yeah.
And he stuck with it a little bit longer, but then it just wasn't, he had to choose between athletics, study halls, all the things. And so they were never really like huge into music when they were little, but curious enough, when band started, they were a part of it. And then with Amira, who's 5.5, she's been obsessed with instruments from the time she was tiny, and she still is. She just can't get enough of it. So talk about that a little bit, children, and that, and what your perspective is on, that journey, and if it will become something and if it will not. I remember you used the word fostering, so.
Sure. So I would argue that human beings are musical, full stop. Mm-hmm. From the time that we're in utero, we start to gain abilities to recognize patterns in rhythm and patterns in pitch and patterns in syntax and sentences even by the time that we're born. There are just things that human beings start to glom onto. Music is one of those things, in my opinion. Mm-hmm. As far as it being fostered, like anything else, the more that someone is supportive of it and shows the joys and the journeys and the ups and downs and being realistic about something with music, like I think that becomes more frequent and more of a staple for someone. Music, like many of the other senses, and well, music's not a sense, but uses a couple, it definitely does a lot with connecting someone to a moment or connecting someone to a part of life. And sometimes that can be very beneficial or it can be very harmful. Music can be connected to a very bad memory and a very troubling past, and music that you're not comfortable listening to. For me, I listened to, and sometimes still do, a lot of very heavy and intense music when I was, a teenager, as a lot of people do. And I still really like that music. But I know people that are like, I don't like that part of me. I'm not willing to listen to that anymore. And so it can be very, triggering is the wrong word. I would say it can be like an open wound almost, where it's like, that's not fully sealed. Mm-hmm. That music can access that. As far as fostering a connection for future growth, I would say the more that someone can show someone how music can be used in a way that's beneficial and enjoyable for them, as opposed to saying, you're a musician, I guess now you have to perform, I think it's a lot more influential. So when I hear about your son saying, I want to do it on my own time, I think that's beautiful. Mm-hmm. Him taking that autonomy and saying, I want to use music and have that be part of my life, but it's more mine, it's less about performing. That's perfect. Mm-hmm. I think everyone's so different with it.
Mm-hmm. You're talking about the music connecting you, back to good or bad memories or parts of your life. Reminds me a lot of our olfactory system and that sense of smell, connecting just the memories that the sense of smell connects us back to. Either the smell of a cologne of someone from 30 years ago can either be,
Absolutely.
Good or bad.
Yeah.
And so very much that totally makes sense. So I just want to share a couple of my personal experiences with how I had some moments of receiving music as therapy, kind of unintentionally, but one of them was, I don't know, maybe last summer. It was an extremely busy day here, back to back with clients, lots of other things going on all at the same time. And I often can get in that fight and flight part of my nervous system, which I'm like actively working on to try to not be in that part, be more in the operating from the rest and digest. But I had one client session left to facilitate for the day, and she was in the room getting prepared for her session, and I came back here for 2 minutes in the room we're in now, and you were next door in the den, and you had your guitar and you were practicing. I believe you were just doing some practicing for a wedding that you were going to be playing at. And I sat in this room next to you with my eyes closed, and just those 2 minutes completely took me from that stress, sympathetic nervous system right into the parasympathetic. Like my breathing changed, my shoulders dropped, and and then I remember coming and knocking on the door and giving you a quick hug before I headed off to session to literally a minute or two completely shifted me from parasympathetic or into the parasympathetic. And it was huge. And then one other thing I remember profoundly, I believe it was last summer, I think it was July, you host your monthly group drumming for people to join. And I had lined up a babysitter for Amira, and I think that day and a couple days previous, I had a few things occur in life that were stressful, and I was like trying to manage that stress, but I could still kind of feel it internally. And what shifted all of that for me was the group drumming experience. And it was just because it brought me completely like into the present moment, creating music together with others. And also, I believe the grounding frequency of drumming brings us deep to our roots, into our core, and helps ground us. When we're grounded, that's our lower chakras, the energy part of me. And when we're a little bit more ungrounded, we can be more up in our head in thoughts, and harder to kind of come down from that. So those are two personal experiences that really just kind of shifted things for me. And it made it easier to like walk away from those experiences and know that like I could maintain that I didn't need to re-pick up where I was previous to that.
I love that.
Yes.
Those are two beautiful moments, and thank you for sharing them. I wrote down two things when you were saying that running into music spontaneously and into something you're like, man, I haven't heard that in a while, or oh wow, I wasn't expecting that. Music can be very invasive in those moments, not in a bad way. It just kind of cuts through the exterior really fast, and that's something that music therapists tend to be aware of, and that other people maybe don't. on some level, that music can be so piercing so quickly, and in a good way for that story that you just shared, that it was able to help you regulate in that moment. And I love the talk about grounding. It's something that I think about a lot with the work that I do. A lot of the clients that I work with are very dysregulated and have a very tough time sitting with themselves and focusing on anything other than I need to be moving, and I feel like I'm crawling out of my own skin. So we think a lot about how we can use music from the sensory framework, and how we can use how we can use lower frequencies and lower vibrations in order to help someone ground and focus on what's in their environment, as opposed to, I can't stop moving. It's like, hey, you can keep moving, but we're just going to start introducing some of these lower tones and frequencies. For me personally, I use a buffalo drum a lot for that, but there's many instruments and approaches that help with that. And I just love using drums, and I love bringing that to someone.
Yes. So as you were speaking about that, it reminded me of mainly when we study the art of sacred healing, Hawaiian Lomi work. Oftentimes music from all different realms and genres are used, and it is so powerful that both the person on the table and the facilitator at the table, and it's not like the relaxation elevator music of massage therapy. It's just, songs that we've all heard from decades, some old classics to some newer things. But what happens when certain songs come on, and what moves people, literally moves like stuck energy. Maybe we're working on a certain part of the body and there's something stuck, and then a certain piece of music will come on, and someone's energy field can lighten and it can move out gently. Sometimes it will move things, and it comes out, that release or that purges, in tears or sobbing or crying or wailing. And the music literally just helps move some stuck energy.
In music therapy, we talk a lot about the concept of music as part of the therapy, and then the difference between that and music as the therapy itself. And sometimes you have to let the music have its space, whether that be listening to music together, playing music together. Sometimes the music does the work, and oftentimes it does if you let it. And so a lot of the work that I've done, both in hospice and in the work that I do now, primarily with kids, but with adults as well, a lot of it is seeing what we can do musically and seeing how that influences someone. And it's less about me making the right choice verbally or me making the right choice like, hey, I'm going to, tap them this way or prompt them this way or whatever. A lot of it is letting the music do what the music does. And for each person, that's very different. But an example for me is seeing someone that is yelling, screaming, and hitting someone, listen to a song that's super loud and super boisterous and super engaging, and then after that be able to sit and pay attention for 15 minutes on an assignment that they haven't been able to do that day. I love that. Just letting the music work. It's like, hey, this is going to help you get these emotions out, get you to regulate, get you to be free in this space where there's no rules here. Like, we're going to listen to this music, we're going to dance, we're going to hit things in terms of like drumming, we're going to strum the guitar, we're going to let this stuff out. And I've seen it in hospice too, where you bring a song to someone that they care about so much. And I think about one client in particular that had a very severe case of Alzheimer's and didn't remember much unless prompted or shown things, and then would forget them quickly, unfortunately. But I remember the song Blue Eyes Crying in the Rain, bringing that to her. And every time I would sing that song to her, she would talk about her mom, talk about her siblings, and talk about sitting on the front porch with them. And they would be coming home from being out in the fields, working with dad or working with mom or whatever. And she would tell me about those memories every time I would sing that song to her. And I was never, that was not me being a great, practitioner. That song has power for her. That song has connection to her. And it's able to access areas of the brain and connect those things that I can't, but the music can.
Mm-hmm. Right. So that was my question, was like something was activated in some part of her brain. Memory, I'm assuming. Do you think it was like a memory of a time when that song was maybe a part of their life and she could then connect back to memories through that song?
Yeah. When I talk to people about what parts of the brain are activated during music, the catchphrase that a lot of therapists use is, hey, it's a whole brain activity, and I completely agree, and I'll give you reasons why. So if I ask you to sing a song that you're familiar with, one, it's going to access areas of your, like the memory centers of your brain. Also, you're thinking about, hey, I need to sing this, I need to breathe here, I know which pitch and the way this goes. So you're thinking about controlling your lungs, controlling your respiratory system, following the person across from you so that you sing together. That's not something I tell people to do. It's like, if I start singing, you generally tend to start singing with me. So it's socially connecting, where I'm trying to pay attention to you and pay attention to that while thinking about memories, let alone if we're doing music like drumming with it and playing just a simple beat, nothing crazy, but just something steady to keep the tempo of the music. There's accessing the motor parts of the brain and connecting those things. And what I'm looking for when I'm bringing music to someone and thinking about how we can activate more of the brain is how many sensory stimulations or how many different types of the five senses can I access at the same time so that I can connect those things for this person. Because oftentimes, let's say like your motor skills aren't great in Parkinson's or in other disabilities, I want to pair musical stimulation with your motor skills, with your memory, with your singing. I want those things occurring simultaneously. It's that phrase that neurons that fire together, wire together. I want to build that as much as I can. And I've seen it in sessions where you bring that to someone and then, hey, their motor skills are a little bit better today. It's like, I don't have other words for that other than I'm trying to connect those areas of the brain that are either weaker or stronger and trying to pair those things together as much as possible.
So good. So good. And for you personally, how do you use music therapy for yourself when you need grounded? What are some of your go-tos and how do you experience those?
Yeah, I get a ton of joy out of listening to a couple different types of music. I love jazz music. I love rap and hip hop music. I love rock music and metal music, and listening to those things is so fun. But I get way more enjoyment out of them when I share them with friends and like, hey, here's what I'm listening to. What are you listening to? Like, oh, cool. Let's both listen to that and then talk about that. It's like, that is so joyful for me and I love it dearly. A lot of the joy I get out of music as well is playing instruments for me, not for work. And music therapists talk about this all the time, where it's, you're getting burnt out on music, but you got into music therapy because you love music. And so it's paradoxical. But for me, a lot of the music that I like to play, I don't bring to my sessions on purpose. So I don't often, sometimes it crosses, but a lot of the times I use music for me in certain songs, certain genres, or well, I don't bring saxophone to sessions much. It's happened, but I do have my saxophone at home that I play for just for me, or a bass guitar that I don't bring to sessions much. Definitely can. I'm not saying you can't, but for me personally, I just don't. And I use those instruments and types of music as, hey, I play these for me. They're fun for me to play. I love this. It brings me a lot of memories of being an undergrad and thinking that I was going to play professionally at some point in my life, which I was disavowed of that notion quick. But I think there's elements of music listening wise, sharing it socially, just playing for me by myself. And it's just fun. It's just fun. And I get a lot of joy out of it.
Was that a dream of yours for one time?
For a short period of time, yeah. For a short period of time.
What shifted that? What did you have a realization that you're like, yeah, that's...
I think it was more along the lines of I was settling more into the idea of I was loving people more than music, and I was seeing as I was trying to become a very good musician and practicing like 2 or 3 hours a day on my saxophone, maybe 5 to 6 days a week for a long time, saying, hey, I don't want to do that the rest of my life. And like a lot of musicians treat it, you'll run into professional musicians that are like, this is my full-time job. I practice 8 hours a day. I'm like, I don't want to do that. There wasn't enough meaning being poured back into me when I would get to the performance or get to those moments where I was like, hey, it's worth it for me. And I was running more into the meaning of like, hey, sharing music with people, playing together and just kind of like jamming or using music in the music therapy setting is like, this stuff is way more fulfilling for me. It was way more engaging for me. So there was a short time when I was like, this is sweet. I'm going to be a professional musician. And shout out to anyone who does that. It's amazing. You know, people who do that, the top 1% of people become successful professional musicians, and it's hard out there. So yeah.
I love what you just said, because I notice a lot of times when people struggle is you were using self-awareness to kind of guide you to like a better fit for what was next for you. I feel like a lot of people can kind of get attached to an idea, and there's parts of it they love and parts of it they don't love, but they're not always self-aware enough to know like, I love this part of it, but this part of it is not something I really want to do. You know, bringing that awareness to the situation, and then they'll force something or kind of venture off their path, sometimes for years, forcing something that really was just an idea that was stuck there, but they didn't really apply. And like the self-awareness to kind of adapt and meld into something that is like all around beautiful and a better fit for them. So I love that.
Yeah, I think that bringing more awareness to your life in general, it's something I talk about a lot as a therapist, is more awareness and being more mindful and using interventions to try and target those things and talking through those things with clients. But in general, for me, mindfulness and awareness has been important for me because life is so full of gray area, and I'm not particularly interested in making it all black and white, even though sometimes my behavior says otherwise. I know that holding the space for the gray areas in life is really important. So for me, that was in those moments was saying, I love music, making music is so fun, practicing it's good, but it's not great. And saying like, hey, there's this thing over here that is so related to this, but I think is way more of a lever for me to pull to find more fulfillment. And this could be so different for each person. Like, it's so important to lean into, if you love playing and you want to keep playing, keep doing that. You know, I know personally I struggle with that, just going home and finding the energy to pick up my instrument to play for me. I know it's good at the other end of it, but I also know that it's tough to make time for those things. Mm-hmm. So if someone really loves playing their music and they're like, hey, I'm in a band, like, we're no good, please come watch us. It's like or it's like, hey, I love doing this just because I love doing it. Mm-hmm. You know, it's vital. It's so vital for life in general. You love doing this, keep doing it.
Mm-hmm. Absolutely. And one more little comment I want to pop over to, because I've been so curious with music therapy and sessions and how you facilitate, and you've been so gracious to go down rabbit holes and answer questions for me. But with a music therapy session, you let the client and their needs lead the way from what I have gathered. And sometimes music is not involved in sessions, correct?
That is very correct. Yeah, it's uncommon, but it does happen. I would say for me it happens sometimes in the course of a month, maybe like 4 times, but it does happen. And I think each person and each situation is sometimes calls for that. I have clients that are, I'm thinking of a client right now that we are way more mental health focused, way more focused on alleviating symptoms of depression and kind of pushing out of that. Music is part of that, like listening to music, creating music. Oftentimes he just needs someone to listen to him, and that's it. And that doesn't require an instrument. So, and I think back to some sessions in hospice where sometimes a client is imminently dying and getting close, and sometimes those moments don't need music. Sometimes they do. Sometimes it's I need to sit and listen and just be with them. Sometimes they're like, hey, we really want this song played. We really want to, sing this together as a family as we're with our loved one. And sometimes people just want another person to be present for them and help hold a space for them where they can dump all the struggles that they're dealing with into this box, and they have somewhere to put it, as opposed to like pushing it back on themselves and within themselves. That can be very damaging. So it definitely happens where music is not a part of the session. So that it goes into our training where we're not trained just to, be musicians. We're trained as therapists. We're trained to hold space for people, trained to assist with emotional and social regulation, to focus on cognition goals, social emotional goals, physical goals, spiritual goals. These are things that we're trained to do.
Do you feel that you have kind of a good sense of intuition as to be able to apply what is needed or back off if music isn't needed? Do you feel you learned that? Do you feel it's an intuition, a gift?
Still learning that.
Gotcha.
Still learning that.
So, okay, I didn't know if you could just kind of intuit it, or if you ask questions. What do you need right now?
Ask a ton of questions. Yeah. Well, I mean, a lot of the clients I work with, they're not verbal.
Sure.
So, you ask questions in different ways. But yeah, a lot of the work that I do is asking questions, and intuition's obviously part of it. Human beings are different levels of intuitive across all humans. But at the end of the day, like you said, meeting the client's needs where they're at for that day is very much at the crux of music therapy, not just what I do, but I would argue the vast majority of music therapists are focused very much on what are your strengths, what are your weaknesses, what do you need today, what are your needs in general, how do we meet you there so that we can pull you to somewhere where you want to be, not where I think you need to be. But, you're here, I'm going to meet you here, we're going to modulate and move to where you want to be, either physically or cognitively or what have you. And I love that process, and it's very much a process. It's very much process-oriented therapy. It's not focused solely on we hit this objective and then we're out of here. Even though we do have, objectives that we're working on that are very clearly defined, that's only a part of what we do.
I'm smirking because what you just said, we've had conversations previous, like kind of how public school systems are set up, where there is an agenda and this is our plan for today and we have to reach this. And there's not really a lot of room for, like you said, like student leading their own process of learning. So
it's a difficult environment a lot of the time, and it's so hard because a lot of it isn't on the teachers or the staff or the people that are there. A lot of the system that is set up is not conducive for, I can speak specifically to special needs individuals that are in schools. I can't speak more to the traditional side of things where, other than that, all I can tell you is that there's a lot of room for growth for that. There's a lot of area of need for that, for kids to have space to be more process oriented, and for the curriculum to meet a kid where they're at and help them learn a skill. I have a client that's turning 10 soon and wasn't able to read a year ago, and now he can, as as part of music therapy, where we worked very hard on that, very hard on teaching him his letters and very hard on speech sounds. And working alongside what his mom was doing and also what his mom was sharing with me about what the school staff was doing, and reaching out to school staff and saying, hey, what are you guys doing? How can I help? Like, what can I support with you? And I'm not saying it was all me. It definitely was not. But I know that I was a big part of that, and helping him learn how to read, and helping him build, not even, the skill itself, but also building the confidence and the wherewithal to say, hey, I can do this in an alternative way and still get a great outcome. I think that's so important.
Yes. Awesome. An amazing tool that isn't currently conventional,
No.
But it's so wonderful that you were available to be a part of that process and have that breakthrough. Very exciting. Well, Brandon, our time is running short. I am so pleased with you joining me today and our conversation. So good, so good, so good.
I just looked at the clock. I can't believe it's almost been an hour. That's crazy.
Yeah, there's so much to explore. And I feel, like I said, in the Midwest, I feel like this is a fairly new idea. But it's so exciting to kind of be out on the leading edge of it and be able to help reach people in a whole new way. So
I would encourage anyone that's interested about music therapy to look into it, find a music therapist in your area, shoot an email to them. People are usually very receptive, music therapists. If you say, hey, I just want to know more. I don't know what you do. Please tell me.
Yeah, and for anyone that wanted to specifically talk with you or have a conversation or ask more questions, how can someone connect with or reach you?
Yeah, so my website is downbeatmusictherapy.com. You can find all my contact info on there, my phone number as well as my email. And feel free to reach out, find that website, find me. I would love to speak with anyone that's curious about what music therapy is, or if they're struggling and have a loved one that's struggling and think that it might be a good option to try or just get some ideas and bounce some ideas off of one another. I'd love to be a resource.
Wonderful. Great. Thank you again for joining.
My pleasure.